Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, what if health policies were written with many future generations in mind? I'm joined by Paul Fleming, Associate Professor and co-founder of the Collaborative for Transformative Public Health at the University of Michigan School of Public Health, and the author of a new book, Imagine Doing Better: Why Policies Backfire and How Prevention Thinking Can Change Everything. We talk about where big picture thinking falls down in policy and reality, the forces to contend with, and the potential power that individuals have when they come together. Let's listen. Paul Fleming, thank you so much for joining us on Public Health on Call. How are you today?
Doing great. How are you?
I'm good. We're excited to have you. Would you please tell us a bit about you and your work?
Absolutely. So my name is Paul Fleming. I work at the University of Michigan School of Public Health, and I focus on addressing the root causes of health inequities. So that means that I partner with a lot of different public health institutions like health departments, federally qualified health centers, and really strategize how do we build equity and thriving into those organizations.
And so you have a new book. It's called Imagine Doing Better: Why Policies Backfire and How Prevention Thinking Can Change Everything. And it sets out this thesis that the U.S. is stuck in sort of a cycle of reactive policymaking. And I think public health sort of inherently understands this concept of sort of more upstream interventions. But can you talk a little bit about this and maybe give us some examples of where public policy and public health might be at odds here?
So much of our policies in this country are trying to look at a problem right in front of us and trying to come up with some sort of solution. And even worse than that, so many of our policy solutions were created decades ago, and we're still sort of just going with them and tinkering around the edges. And what the book invites us to do, and I think, it connects obviously to public health, is using prevention thinking, where we are actually trying to find root causes of major issues in our society, major issues like climate change, community violence, political polarization. What are the root causes of those? And then using that prevention mindset to get in front of them, rather than just kind of sticking with status quo policies that have shown that they are not working to address these bigger problems.
Well, let's pick probably maybe one of the thornier ones of those examples. Let's look at climate change. Like, what are the root causes of climate change?
Yeah. When we think about climate change, so much of what we try to do is really, there's a lot of talk about, how we can change individual behaviors if people just recycle more, if people just, change slight behaviors. But really, the solutions for climate change are policy solutions, because we need to enable people to make those decisions. And the way that our policies are currently structured make it actually really challenging for individuals to make some of those decisions that we need that would promote a healthier planet. And I think one of the root causes really is our economic policies and how we have enabled corporations and other businesses to earn profits at the expense of our planet. And so you can imagine, certain types of regulation and other things that would be public policies that help prevent climate change and actually incentivize businesses to do better for our planet.
I think one might read your book and maybe think to themselves, like, isn't this sort of why people get into public health and public policy to begin with, like to address these root causes? And they might even look at climate change the way you are. So what gets in the way?
Yeah, absolutely. I think one of the things that gets in the way is we get so stuck in this thinking of what's right in front of us. So what's coming up in the next week or the next year? And we lose sight of this long-term thinking, which is a big theme for the book, and I think a theme for public health. Long-term thinking, when I talk about that, I'm not just talking about the 5-year time frame, which so often in public health research, that's the time frame we're working with, and even policymaking, we're making budgets in multi-year stages. What I'm talking about is really inviting us to think generationally, thinking about generations into the future. And, this draws on thinking from indigenous communities in the US and elsewhere that planned public policies and planned their communities around this 7 generations thinking. So how will what we're doing today impact 7 generations into the future? Now, that's a far way away from the type of policymaking we do right now, which so often is really thinking about the next election cycle or the next year. And I think we really do need to create more space within public health and in our policymaking to step back and think about what kind of world do we want to be handing off to the next generation or future generations? And then crafting policies that help us plant seeds today to create that future.
And when you say creating space, like who is creating this space? Is this like a funding conversation? Is this a political conversation? Where do you envision this happening?
I think it can happen on all the different levels, and that's where it needs to. So part of it is in our day-to-day lives, we need to be creating space for imagination and dreaming what that better future is. So that means that when I'm teaching a class, I need to bring that into the classroom. When I'm leading research teams, I need to be fostering that within the research teams. But at a much higher level, when we're thinking about our politics and policymaking, wouldn't it be great if some of the debates that we have between politicians of one party and the other are actually a conversation about what is the future that we want to hand off to our great-grandchildren? I think sometimes our policymakers give a little bit of lip service to this, but I haven't really heard policymakers or our politicians dig in this way of really describing what is the future that we want to build and what is the vision that voters might be able to buy into. And so I think us as voters also have a role to demand that and be asking those questions, not just what is the small tweak or what is the small specific policy, but what is actually the grand vision that we have together.
I think, for example, about like moonshot policies, right? Like these big complex plans for like ending something, like, for example, ending HIV by a certain time, or, the World Health Organization's Sustainable Development Goals, things like that. And then often they have the vision, they may even have the policy and the ideas down on paper, but then it runs into reality. So how do you contend with reality with these kinds of things?
Yeah, I love those examples of the moonshot or, these larger goals that sometimes we do see institutions rallying around. And I think part of what gets lost in those conversations is that the way that we are going to get there is only in this technocratic way. At its core, when we're talking about big transformational change, that happens through people power, and it happens through building movements. And so some of these big goals that we have in public health, thinking about healthy people 2030, for example, where we are thinking future oriented, what we try to do loses sight of the fact that we need a broad movement within our communities. And that's where, and I discussed this in the book a bit, strategies related to community organizing and building relationships and building coalitions. Of course, public health and policymakers do some of this, but so much of the large changes that we've seen over the years, over the decades, has come from people power and people demanding change. And so when we think in our institutions within public health or in other places related to climate change, we are doing some of that dreaming. We are projecting into the future. But what we're losing sight of is that we can't just solve it with data and technocrats. We actually need to engage and involve whole communities, whole societies in this transformative change.
How do you do that work? I mean, I think especially at a time right now where people might, have lost sight of the future and they might really just be trying to solve problems in the here and now.
Yeah, I mean, at its core, and this is a big conversation we've been having in public health, it is about trust and about relationships. And so you really can't do anything as a collective, as a group, without building that trust and relationships first. So that's the first place to focus. But, turning to community organizing strategies, and there are actual tools that community organizers use. And so often community organizers are working at a grassroots level, thinking about their own communities. But at the core, you are trying to build people power, and that happens through relationships. So you are bringing people together, you're understanding what their core interests are, you're aligning, where do our interests align? We each want to have families that are able to thrive. We're able to sustain ourselves. We're able to have food and shelter and all these things. So identifying some of the places where our interests align and then really acting in unison. That's sort of that collective thinking. So much of our culture encourages us to really think at the individual level, and we need to foster this collective thinking and collective action through our relationships.
What kind of forces do you think we're up against with this kind of work?
Yeah, the forces are big. And, when I talk to different audiences or groups, I think this always comes up. But we can't lose sight of the fact that we do have power. Alice Walker has a famous quote that I'll probably butcher a little bit, but it goes something like, the biggest way people give up power is by thinking they don't have any. And that's a really key insight for us, and I think a mindset shift that we need to have. Are the challenges and the headwinds gigantic? Yes, certainly they are. We are sometimes contending against people with billions and trillions of dollars that are pushing in a different direction. But the reality is that each one of us individually does have power in different ways, whether it's relational power, economic power, positional power. And then when we combine with other people, we multiply that power, and that people power grows. And we have seen that people power can push against these large forces. And so I think one of the ways that we're in a tricky place right now is that there are a lot of people that are leaning into hopelessness, leaning into despair, feeling like, the future is already a foregone conclusion. We don't really have any say in what's going to happen. But the reality is we do have power, and especially when we come together, we can shift the path that we are on. And so that's what I think we need to be focusing on in this moment.
Well, why don't you leave us on a little bit of a hopeful note? I'd love to know where you see this work happening in the world right now.
If you look for it, there are so many places across the world where you can draw hope from. I think to places like Minneapolis, where when they were contending with large-scale federal forces that were arresting and deporting and sometimes killing residents, the communities mobilized. They organized so well. They connected within their neighborhoods. They identified what were the needs. They drew on principles of mutual aid, meaning that within the community, we have abundant resources. Right? So as an individual, you may not have everything, but as a community, we have abundant resources. And so how do we lean into sharing? And that idea and that concept is really counter to a lot of where our culture pushes us into this individual thinking. And so I think Minneapolis was a great example of a collective coming together and pushing back against a force that was harming its residents.
Well, Paul Fleming, thank you so much for joining us. It really is nice for a moment to imagine doing better. We appreciate your work.
Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.